Coxarthrosis. The very word arthrosis means aging due to poor blood supply. Here is our hip joint, the ball and socket joint, and the acetabulum. And in this place where our joint moves, the head of the femur moves within this socket, various movements occur, but movement between the two articular surfaces goes smoothly when there is synovial fluid in the joint. And synovial fluid in the joint isn't just sitting there. It's produced every day, just like saliva is produced in the mouth. But just as saliva is swallowed, synovial fluid in the joint is constantly being used up, so to speak. That is, because the joint is constantly moving, the synovial fluid in the joint is used up due to this movement. But just as synovial fluid is consumed, it is also produced in the same way. And synovial fluid is produced to the extent that blood flows to the joint through the blood vessels. So blood flows to the joint. There is synovial fluid in the joint, and the joint moves perfectly. But with age, most often with age, sometimes after an injury, but most often with age, there is a decrease in blood flow to, any joint, including the hip joint. As a result of the reduced blood flow, the production of synovial fluid decreases, and then the joint starts to function during movement, but not fully lubricated. Because of this, the articular surfaces wear down and the cartilage wears away. The cartilage gets worn out, its thickness decreases, and then the joint space narrows. That is, the gap between the acetabulum and the head of the femur becomes smaller, and as a result, the range of motion in the hip joint decreases. Because of this, the joint becomes less mobile, its movement becomes restricted. Contracture, and as a result of this contracture, bony growth, bone spurs osteophytes begin to form in the joint. And also, because one cartilage rubs against another and there isn't proper lubrication, the cartilage becomes ulcerated, its smoothness decreases, and it starts to develop small holes. In this area, when the cartilage is worn out like that, the mobility of the joint decreases even further. That's the problem. That's what coxarthrosis is. It's when aging develops in the joint and the mobility of the joint is impaired. And everyone says your joint is worn out. The cartilage in your joint is worn away. Cartilage does not regenerate. The joint needs to be replaced. So let's figure out coxarthrosis together. What caused coxarthrosis? Where did the whole problem start? If there is an inflammatory process in the joint, arthritis, then the cause is either an injury or rheumatism or some other process that triggered inflammation and damage. But with coxarthrosis, the problem initially starts with poor blood supply to the joint as we age. Because of this, there is less lubrication, more cartilage wear, and the joint becomes less mobile. And so, taking this cause of coxarthrosis into account, that's how the problem should be addressed. And in order to even identify this problem, whether there is coxarthrosis and whether it needs to be treated, you need to determine if this disease is actually present or not. Usually, an instrumental examination is performed. Typically, movement is not assessed. Instead, the condition of the joint itself is examined. An X-ray is taken. On the X-ray, they look to see whether the bone surface is intact or ulcerated. On the X-ray, they determine the shape of the acetabulum and the shape of the femoral head. On the X-ray, they also assess the width of the joint space. With MRI, magnetic resonance imaging, it is possible to see other structures, the ligamentous apparatus and the cartilaginous parts of the joints. But as a doctor, I very often see the following situation. When the hip joint appears generally normal on the X-ray, but the person complains of hip pain, a diagnosis of coxarthrosis is made sometimes even advanced stages, like stage 2 or 3. There are no catastrophic changes visible on the X-ray. The patient's condition is complicated, their overall state is poor, and they have pain in the hip joint. Their leg hurts, and they are unable to walk. And so, even when the X-ray findings are more or less satisfactory, an advanced stage of coxarthrosis is diagnosed. That's why, for me as a doctor, it is fundamentally important to determine, is it really coxarthrosis or should it be differentiated from arthralgia? And for that, during the neurological examination, I perform a nerve root block. Don't do anything with your leg, don't move it at all. You'll feel a pulling sensation in the back of your leg. That's the stretched nerve root. There, I've blocked the nerve root. People often ask me, Dr. Golod, how do you block the nerve root? I just did it right in front of you. I blocked the nerve root, and at that moment, the back no longer affects the joint. At this point, I check the hip joint through 3 ranges of motion. First, flexion. I check the movement, and not just whether the leg moves or not, but also whether there is any pain in this case. Although you don't even need to ask about this. You can see it from the patient's facial expression when I move it. And there is no pain in the joint during flexion and extension. The second range of motion, which I call abduction. Here, I move the leg out almost into a split position. If here, in this kind of range of motion, the joint can extend up to 90 degrees, that would be a full split. In this case, the extension of the joint is about 80%, which is practically ideal. It's remarkable that in people who have been diagnosed with stage 3 arthrosis, coxarthrosis, after I block the nerve root, I'm able to move the joint into a split position. This clearly indicates that there is no arthrosis, and the pain was actually caused by compression of the L1 and L2 roots in the spine. So this isn't coxarthrosis, it's arthralgia. The third movement I perform is rotation. External rotation and internal rotation. And at the extreme points of abduction and rotation, you can also notice there may be pain, and this pain will indicate problems within the joint itself. But how often do I encounter this in my practice? In approximately 90 out of 100 cases involving the hip joint, after the nerve root is blocked, the joint moves well and there is no pain in the joint. In such cases, this is not arthrosis, it's hip joint arthralgia caused by a problem with the spine. But if we do find that it is coxarthrosis, I block the nerve root and still notice pain during movements, especially abduction. The pain is such that if I press a little harder or move the leg a bit further out, it immediately causes an ouch. It hurts right away. In that case, it really is arthrosis. Then it means the joint is diseased, worn out, eroded, aged due to poor blood supply. And in such a case, the solution to the problem is always based on the cause of the disease. The cause of coxarthrosis is poor blood supply to the joint. This cause does not require us to operate on the joint. You can replace the joint, you can put in a metal implant, and the person will be able to live with it for a long time. Well, at least until that joint wears out again. But if there is a possibility to restore the joint without surgery, I still recommend not resorting to surgery as long as there is a chance for non-surgical joint recovery. So the problem started with poor blood flow to the joint. For warming, we wrap the hip joint, and most often both hip joints. I use turmanium ceramic. It doesn't matter what shape it is, whether it's a mat, a belt, or a cover. What matters is that the product is made from turmanium ceramic material. When heated, turmanium ceramic emits warmth similar to the warmth of my own body. And it is precisely this kind of heat that allows for deep warming, not just 2 or 3 centimeters like water heat, but penetrating deeply, reaching directly to the hip joint. That's why you can't warm up the hip joints with a regular rubber hot water bottle. To warm them up, you specifically need the infrared heat from turmanium ceramic. And the belt, well, the belt is simply more convenient for warming both hip joints at the same time. Let me say right away, the warming process is not simple. So it requires a long period of time, at least several hours. And it's best to do this warming in the evening so that the relaxed muscles don't interfere with walking afterwards. So even if you warm the joints for several hours, it's better to do it in the evenings. And You should keep in mind that after such warming, it's essential to make sure that the blood that has come to the joint and the lubrication that has formed as a result of the warming actually lubricates the joint surfaces. What is recommended? After warming up, stand up and do some forward and backward leg movements. Swinging movements, shift your weight onto one leg and make swinging movements with the other. Or move your leg out to the side. This helps to further lubricate the joint surfaces and increases joint mobility. It's not enough to simply warm up the joint. After warming, you definitely need to work the joint. But to wrap up this topic, I'll say right away, in practice, the problem is very often not in the hip joint itself. The problem can be in two areas, both in the spine and in the joint. In the joint, because due to lack of movement, the joint has for a long time suffered from reduced blood supply and there's no lubrication there. I find coxarthrosis to some degree in almost every patient. But at the same time, due to the harmful habit of sleeping on your side, damage occurs not only in the joint, but also in the spine itself. That's why, in addition to warming up and working on the joints, it's absolutely necessary to maintain the correct sleeping position. Change your position on your side. By the way, when a person is lying on their side, there is compression of the L1 and L2 nerve roots. And change your mattress if it's not right and allows you to sleep on your side, replace it with a firm one. Then on a firm surface, you will inevitably end up lying on your back. Yes, you can do traction, stretching for your back. There is mechanical traction equipment which will solve the problem of pinched nerve roots. But people often warm up their joints, do exercises, even use mechanical traction, yet the hip joints still continue to hurt. I see the main reason for this as the fact that the person simply hasn't changed the position in which they sleep. Therefore, to solve the problem of the hip joint in cases of coxarthrosis or hip joint arthralgia, it is absolutely necessary to also change the position in which a person sleeps. Just think about it, you spend 6, 7, even 8 hours in such a bent position, your back as well, and this leads to pain later on in the knees and hip joints. So today we talked about coxarthrosis.